treatment group video for obsessive compulsive and related disorders. My name is Lena Lange-Kram. My client's name is Luca Ciapella, and he's 42 years old. The only differential diagnosis that fits this client is body dysmorphic disorder, which has been ruled in. Primary diagnostic features of this disorder are preoccupation with imagined defect in one's appearance or disproportional concern regarding slight defect. So Luca's story, like I said, he's 42 years old, and he's being assessed after a recent suicide attempt. His wife recently separated from him, and he was fired from his job. When Luca enters the room to be assessed, he wants the room to be dark. He wears a baseball cap over his face. He looks down at the floor, and he doesn't make eye contact when he's answering questions. He was fired, he believes, because he missed a lot of work. According to him, it's because of his disformities of his face. His eyes are too close, his nose is misshapen, his chin protrudes, and he believes he has severe skin blemishes. He claims he's been obsessed with his facial appearance since he was a teenager, though the most distressing he's ever been has been in the last 5 years. He believes everyone is repulsed by his appearance, and he doesn't like to leave the house or be seen by people. His wife and friends constantly reassure him that he's an attractive man and he has nothing to feel self-conscious about. And he'll reflect on those comments for a while and slightly believe them, but then he'll go back to looking in the mirror and obsessively watching himself. And that's where his doubts return. He expresses the constant impulse to check himself in the mirror at times for extended periods of time. He's been to several dermatologists to ask for dermabrasion. The first dermatologist he went to denied him because he said he didn't have any cause for the procedure. And then he went to a second one who performed the procedure, but he saw no difference. And from that point, Luca requested that he have some kind of reconstructive surgery. And the doctor or the dermatologist denied that, and they recommended he go to get psychiatric evaluation. So that's where we are right now with our client, Luca. The multi-axial diagnosis for Luca are Axis 1, body dysmorphic disorder, Axis 2, none, Axis 3, recent suicide attempt, Axis 4, recent separation from wife and fired from his job, and Axis 5, he has a GAF of 54. The theoretical perspectives involved in this case, first are the biological perspective. So genetic predisposition may play a role in the development of this disorder. The client may have abnormalities in the limbic system, frontal cortex, and temporal lobes. Abnormalities may indicate inefficient connectivity between these areas in the brain, and the results are deficits in cognitive and emotional regulation. The client may have a deficiency in serotonin that contributes to the compulsive behaviors associated with this disorder. Additionally, when the client engages in compulsive behaviors, dopamine is released, resulting in a pleasure response. The pleasure response makes the likelihood of the client continuing to engage in this compulsive behavior more likely. The next perspective is the behavioral perspective, which states that the client may have developed PDD from a faulty learning experience. The client experiences tension and anxiety related to his disorder perception of himself. Operant conditioning may explain how the client, in order to relieve some of his tension and anxiety, engages in compulsive and ritualistic behavior. This is seen in his behaviors of staring in the mirror for long periods of time. This compulsive behavior relieves his anxiety and tension and is the result of negative reinforcement. The last perspective is the cognitive perspective. The client has perceptual distortions regarding his appearance. He is convinced his nose is distorted, his eyes are too close together, his chin protrudes, and his skin has blemishes. At times, he considers the feedback from others who reassure him that he's handsome, yet he will reject a thought when he looks at himself in the mirror again. The perceptual distortion overrules any objective feedback from others. So this was the treatment group for Luca Ciapella, and my name is Lena Lange-Kram. Thank you.